We know that human milk and breastfeeding is the best thing for all infants, whether they be hospitalized infants or the infants of our employees.
Putting a breastfeeding support program in place is important for your employees, it's important for their families, and it's the right thing to do. We did it fairly inexpensively. You don't have to spend a lot of money to do it. It's easy, and the return you get from the satisfaction from your employees, you can't buy that.
Well, I think that, when you return to work, every new mom, it's going to be a scary experience. And utilizing the lactation rooms really gave me the opportunity to have a routine and to put a routine to a very new process, which was be a working mom. So I would be able to come in the morning, pump before I went to work, pump at lunchtime, and then pump right again before I left. It really gave me that foundation that I needed to be a successful working mother employee.
For a mother who has a critically ill baby in the NICU, it's the one thing that only she can do that makes a total difference in the outcome of her child's care. So every day that a mother breastfeeds or pumps, she's providing her baby with a daily dose of vaccine. No formula could ever do that for a child.
Breastfeeding is critical to a baby that's born with abdominal wall defects because of her digestive issues. And I know that my milk is custom made especially for her, and it's the only thing that I could really do to ensure optimal nutrition and that we were as close as possible. With all that, the chaos that was going on in our lives, it was the one thing that I had control of and the one thing that I knew that I could do to help her.
We have employees who are excellent, who appreciate that we give them this space, and they obviously will work harder and work with us longer. Carolyn, for example, has been with us 10 years and recently went over and became manager of our new place, Trolley Cafe in East Falls.
Being an employee here and also having a second child, I knew I was going to breastfeed. And this time around, it was a goal for me to at least reach a year in breastfeeding. I had done 4 months with my son, and this time around I really wanted to reach the year. So it was very important for me to know that my employer was aware of that and supportive of that and created a space that I could do that safely, quickly, efficiently, and they did. They were very supportive in that.
It is just something that I think happens naturally. We are a family-friendly restaurant. We strive to be comfortable for everyone who comes in.
I'm a breastfeeding mom because it's the best thing for my twins, nutrition. It helps with their immune system, it helps them grow, especially since they were preemies. So, it's the best thing for them.
Part of being a business is having some responsibility for society at large and for the community that you're in. And I think we probably could all acknowledge that breastfeeding is best for the children and for society.
Certainly there's challenges to being a nursing-friendly restaurant. There's other customers, some of whom may not appreciate it as much as we do. But in the end, with the health benefits of nursing, we just think it's really important to take a stand on this and say we're going to be nursing-friendly and follow that.
We encourage the parents to breastfeed because we believe that breastfeeding is the best for children in the early months. And so it's a natural fit with our services, ensuring that children have what they need to grow and develop appropriately.
They're more alert, they're ready to learn because they don't have the insecurities that a lot of our other say bottle-fed babies that may not be tolerating their formulas as well are just really cranky and just not really settled. And so as a result of not being settled, then learning can be impacted. And so we can see that they're really receptive and ready to learn. And that's evidenced by our developmental screenings.
So many of our families are struggling. So if they're breastfeeding, they don't have to have that added expense of buying the formula.
One of the other coworkers is actually a birth doula, and she has a lot of knowledge about breastfeeding. So she was able to help me out and kind of get me started and let me know some of the things that may go wrong and what to expect. So it was very, very supportive just to have someone with all of that knowledge kind of being able to help me make the choice.
You know, we make a special effort just to make sure that we deliver quality services not just to the community, but to our staff as well.
And our staff have also been examples for some of our clients in that, you know, they've been breastfeeding parents themselves and have also, you know, shared their experiences.
Yeah, there you go.